really big question, why should the NHS care about strategic communications? I don't think it'll be a surprise to anyone watching this interview that, the NHS is facing an existential challenge. The pressures are absolutely massive, and it feels like every day there's more coverage in the headlines about waiting lists and the ongoing financial pressures on the NHS and staffing and everything else. So within that context, we also have a UK population that's declining in overall health. So that means that people are living less years in good health, and actually overall life expectancy isn't increasing anymore as it had been doing for quite a long time. But, of course, the reality is that situation isn't all down to healthcare and healthcare provision. So the NHS can't fix that in and of itself. It's not a case of having more surgeons and more doctors and more nurses. Actually, we've got to be thinking about the wider determinants. So what are the things that affect people's health and well-being on a day-to-day basis? And that's about having healthy communities, about having meaningful work, about having safe housing, a good, clean, safe environment to live in. And all of those things contribute to not only well-being, but to good health and to longevity and to the number of years lived in good health. So when you bring that into the context of strategic communications, it's really important that the public has a good enough knowledge and understanding of this narrative, but specifically for them to know and do what they can to keep themselves healthy. So there's definitely a role for strategic communications in empowering people. But also, the other aspect of that is helping to empower the general public in terms of knowing what they can do and how they can be putting pressure in terms of the policy space to be able to influence towards more favorable policies that favor health and well-being. So actually, I see those as being two really, really important strands to how strategic communications can help the NHS. And I think that's not specific to any particular health trust or any particular NHS organization. It's really about how, as a kind of health comms community, we kind of hold those principles in some of the work that we do. In Wales, we take our commission effectively from Welsh Government in terms of what we're asked to do and how we respond to the health policy. But we have a role in influencing health policy by providing health intelligence, by providing evidence, by providing really good research that helps policymakers to understand how changing the policy landscape could lead to better health and well-being for people in Wales. So there's a really strong connection in terms of the work that we do, particularly in public health. But from a strategic communications point of view, we've got a role in helping to kind of like roll the pitch, as it were. So what do we do to help to shape the public discourse? What is the conversation that's happening in the media, and how do we proactively get in there to help shape the stories and the nuance of how those things should be covered, so that we're influencing the general public through the use of media as well as kind of other channels? We know, for example, through research evidence that promoting foods that are high fat, high salt, high sugar leads to poorer health outcomes. And there's loads of research evidence around this. And we knew at the same time that Welsh Government were aware of that particular set of information and research, and were lining up a policy statement about the food environment and the healthy food environment. So thinking about this strategically, what we're able to do then is use our research arm to ask the public some questions about what they think about the healthy food environment, food promotions, etc., and whether they are in favor of changes to policy. So helpfully, what we found was that the general public, when asked, do feel that government has a role in shaping the healthy food environment. And so we were able to share that finding that kind of helps the policy picture to land in a slightly more favorable way. And I think in the context of public health and the context of influencing the wider determinants and in terms of influencing policy, because we've got an evidence-based public health aim, that role of strategic communications can help us achieve where we're trying to get to in the long term. I guess to summarize it in one sentence, I would say the scale and the pace of change. And I think that was probably experienced by everybody across the UK and globally. But when I think back on kind of my leadership experience through that time, I think of the term VUCA. So you might have come across this as like a kind of leadership jargon, and it stands for volatile, uncertain, complex, and ambiguous. And originally it was a set of terms that was set out by, I think it was the American military following the Cold War, when they had to kind of reestablish how they were going to deal with this really rapidly changing and rapidly shifted global landscape. So it comes from this military background, and it basically says that those 4 different things, you can devise different responses to those scenarios based on kind of precedent. But actually, my lived experience of the COVID scenario was that it was like kind of VUCA on steroids, right? So everything was more volatile, more uncertain, more complex, and more ambiguous all at the same time. So we expect to deal with that in our roles, but it was just the amplification of all of that all at once that made it so challenging. And it was just like everything was turned up to 11, you know? And the way that I chose to approach it was to really lean back on my training, really lean back on the exercising and the work that we'd done in the years leading up to the pandemic and getting our team into a really good place. Relying on my knowledge, you know, I know what I'm doing, my team know what we're doing, we've got really good skills and capability. Relying on the relationships of the people around me, I think that was really critical. And specifically within that, really finding myself being more authentically vulnerable in my leadership role than I'd ever been called upon to be in any other context. And so kind of learning that it was okay to share my emotional state, not to the extent that it would negatively affect others, but actually that, you know, I'm human too, and sharing that humanity, I think, really helped the people around me, and particularly the people on my team. So I think those were really important things. So really turning to best practice, using the best practice, giving people scope to explore and kind of, you know, do the things that they're really good at and bring solutions to the table at pace. But really like relying on our craft and relying on our skills was something that we did every day. I think consistency is a really big theme for me, in terms of building trust and how you do that, and also sticking to our territory. So, you know, really sticking to the things that we're responsible for having a message on for the public, and being really clear and consistent about those things, and really kind of doing the best that we could to proactively get on top of as much of the information as we could, and reassuring people when we didn't have the information necessarily. And some of that is reflected in the decisions that we made on a really tactical level. So decisions that we made about how we published our stats on a daily basis at a specific time so that we could set expectations, deliver with consistency, and make it so that people knew what to expect on a day-to-day basis. You know, we also, I think, reflected what was happening in the public's mind and how people were thinking and feeling by keeping a really close eye on what was happening in the social media space. And that allowed us to respond to what was happening out there in the world around us. And I think that also had a big role in how we developed a level of trust. It was really kind of making sure that our messaging and talking to people was on the level that people were at that moment in time. So one of the things that we did quite early on in the pandemic, when the first lockdown came around, was we were really fortunate to be able to work with some quite famous faces in Wales who were happy to work with us to help us just reinforce the messaging. And rather than coming out and saying, you must stay home, you should do this, you should do that, we turned it around and we used the principles of social norming to say thank you to people and say, actually, you know, we know that most people are complying with the rules, and thank you for doing that, and this is why it helps. So we kind of were really, I think, human about the way that we communicated some of the messages through that COVID period. But yeah, I think that consistency and our sense of honesty was really important. And then finally, I would add, we're very fortunate to have some really competent spokespeople, and we were quite consistent in how we used those spokespeople through the pandemic period, and that built up a lot of trust in those individuals that then kind of translated in trust in what we were saying as well. Working within the context of Wales, we were able to work across the whole of the public sector to really use the same overarching campaign kind of mechanism to get our messages across. So we use the Keep Wales Safe brand architecture to deliver a lot of the messages themselves. And then the other piece, and I talked about this a little bit earlier, was around consistency. So that's about being consistency and owning your territory and knowing what it is that you can speak on as an organization. And then secondly, sticking to the messaging that has been approved and cleared and reiterating it so that we're not coming out with a different version of a press release every day. We're actually doing a lot of reiterating of the same messages over and over to try to gain cut through of those consistent pieces. And you know, for anyone that's interested, the WHO has like a whole piece of work they're doing around infodemic and that whole set of concepts, and you can just go and type it into the search bar on their website and see the resources and research that they've got there. In terms of misinformation and disinformation, I mean, I think we would all agree it was like one of these really big emerging themes that hit us as communicators, and we were all sort of going, wow, that was maybe bigger or worse or more challenging than some of us might have expected. So a response was definitely required. I think it's really challenging to come up with really rapid, on-the-minute responses when you're a large organization that typically would operate with lots of layers of approval and needing to kind of take things, you know, quite in considered fashion. So that creates a bit of a challenge from a kind of corporate messaging perspective. But as a communications team, what we could see around us was definitely that, you know, the misinformation strands were quite real. We took the approach of we kept all of our channels open during the pandemic. So I think that's the first thing to say. Not every organization did or was able to do that, and we did. So we had hundreds of thousands of direct messages and hundreds of thousands of comments on our channels. And that called upon us to make some decisions at certain points in time. And we had made a decision about being open and transparent and accessible, which is why we kept all our comments on. But there were certain times and certain topics where we took decisions to close the comments. Some of that was because we did not want to elicit the kind of pile-on of mis and disinformation. Some of it was because we had to manage our mental health. You know, there's times when you just need to be able to step away from the social media channels on a Friday night at 5 p.m. and not worry that the whole weekend is going to run away with you, or that the person who's working the on-call shift on Saturday is going to have to deal with a massive mess. So there were some practical considerations as well. But that misinformation, disinformation piece, I guess it was trying to come up with methodologies and tactics. So setting out frameworks for how we would respond and being clear about when we would and when we wouldn't. So we set out some really clear house rules on our social media channels. We called people out for disinformation or misinformation. If there were known actors that would purposely put incorrect information into the channels, we would issue a warning and say, look, you know, we have warned you. After 3 strikes, you know, we did take the decision to ban some people from commenting on streams. So there were the tactics around that. A specific piece of work back in November of 2021. So we knew from the clinical evidence that there were a large number of, or I should say, of the people in intensive care, a disproportionate number of those people were pregnant women. And of those, many of them hadn't had their vaccination. So we were really trying to understand, and we were under some pressure as well from the clinical side to really encourage people to take up that vaccination offer in pregnancy because of the increased risk from diminished like immune response. So our task was to try to understand why women were not taking up the offer of vaccination in pregnancy, and some of that was to do with fear of there having been a lack of information, the fact that it was a new vaccine, the fact that the evidence was emerging, and also this whole concept of disinformation and misinformation that was out there. So to approach that problem, we used our social media channels to undertake some research to really try to understand the barriers and what was kind of influencing people's decisions about whether to take up the vaccine offer or not. And we also wanted to understand who the influencers were in that context. So what we found was that in pregnancy, women are looking in the main to their midwife to give them advice about whether they should or shouldn't take up the vaccine offer. So that was a key finding. And so that led us down the road of trying to understand what the conversations were that midwives were having with their clients, with pregnant women coming in to have that discussion. And it turned out that the midwives themselves weren't entirely comfortable with giving that clear advice to take up the vaccine offer. So we had to work with that group to understand their barriers and understand what was happening there. So we did 2 pieces of work as a result. One, a specific kind of piece of communications targeted at the midwives to help give them the facts and information and walk them through how to have a conversation about vaccination with a family coming in, talking about their pregnancy. And then the second piece was directed specifically at women in pregnancy and helping them to be able to find information that they would need to make decisions. We also really actively made sure that we stayed on top of our social media community in that topic area to make it, to reduce the influence of the people on the fence, I suppose, or the disinformation. So there are people that are putting out purposeful misinformation, and then separately there's people that are sort of, oh, well, I heard that this isn't such a good idea, and is this true kind of stuff, that actually they don't necessarily have ill will or ill intent, but they're misinformed or they're putting out information that isn't actually true, but because they don't necessarily have the facts to hand. So we did a lot of work to really moderate that community really closely on our social media space. And then we worked with kind of closed community groups on Facebook and elsewhere to help to make sure that we were disseminating the kind of correct messages. And we did see a measurable uptake in vaccination in pregnancy from the launch of that campaign onwards, which was really encouraging and really helped us to think through, again, I said before about putting in place like methodologies and tactics and frameworks, and that helped us to kind of build the case for why that was important and gave us a bit of confidence to keep doing it moving forward. The whole COVID experience gave us a really important opportunity to think really hard about health inequalities and how we needed to really make sure that we were including as many communities as possible in the messaging and helping to understand what barriers people were facing to taking up the behaviors that we're asking them to do. So what's standing in the way of people taking up their vaccine offer? What's standing in the way of people using masks when required or staying home when ill, and all of those things. And the most important thing for us really is around listening and trying to understand the challenges and barriers. So actually, it's not about just going out there and blasting the messages out. We've got to give due consideration to what the lived experience of people is in their context. So an example of how you can help to really encourage people to stay home when they test positive for COVID is actually providing them with a financial kind of help if they're going to be, facing financial hardship as a result. So it's also not just about the communications, it's about looking at the wider kind of barriers and policies that we need to be putting in place. But just going back to the role of comms and engagement, that listening piece is really foundational to crafting any targeted messaging that you want to get out to communities. Adapting our channel approach was also really important. So what we've tried to do is to develop trusted relationships within our stakeholder networks and within communities, because even though we like to think that we're a trusted NHS body, actually some people trust their local community leaders or people that they know more than they trust us. So we're able to put our messages in the voice of those trusted community partners to help the messages land more effectively. So I think those are probably 2 of the key ways. And I think just recognizing as well, and I think it's really important to kind of put this on the table, that engagement takes a lot of time and effort. It's not just about setting up a WhatsApp group and blasting some stuff out. It's about building relationships and making it a 2-way situation where you can really hear what's working, what's not working, and what people's needs are. So it definitely takes time and energy to build and then retain that trust. Definitely say what I've seen work really well in the private sector is that they take comms seriously, especially internal communications. And in my experience, that has been a part of the mix that's really well invested in and really well understood to have a significant positive impact on productivity, on staff well-being, on the bottom line. So I think there's definitely some work to do to help internal communications be better understood as a lever for positive change. And that's definitely something that I would be happy to keep talking more about. And I think that that's because, private sector organizations, particularly large corporates, they understand the tangible value of engagement. And so they translate that into investment in those activities. And I think in the health sector in particular, it's often very difficult to make the case for things that could be perceived as less tangible. And I think the other area is around consistency. So really demonstrating a deep commitment to your brand proposition, whether that's a public sector brand proposition or private sector, it's not important. Either one is, you've got to be really, really clear about what your business is, what you're doing, what is the need of the population or your customer or your service user, what's the need that you're intending to meet, and really kind of sticking to that, like ruthless consistency. And that's what, good brand proposition work is about. It's being clear about it and working to deliver towards that. So I think that's something that is done really well in a lot of private sector contexts, and which we could learn and adopt much, much more in the public sector for sure. Here in Wales in particular, but elsewhere I expect as well, I think we really need to continue to build our case for strategic communications. And I mean, really high caliber public campaigning, internal communications, the kind of heady days of the pandemic where leadership looked to communications to solve a lot of the problems are over. And we've kind of gone back to a bit more business as usual, where different parts of the business kind of forget to loop comms back in. So I think that whilst in many places communications teams, communications directors or heads of functions have kind of won a place at the table, we really need to keep working hard to stay there. And I think to do that, you've got to be really committed to your professional development as a leader in communications, really committed to maintaining standards, both for yourself and for your teams. I'm a big believer in your membership in professional bodies as a demonstration of that. And also really trusting that communications can be a really big, important lever for change, and also for being the voice of the patient. So I think there's definitely, it's not necessarily like a new challenge ahead, but I think it's really holding on and keeping on driving forward, kind of making that case for communications as a strategic function, as a strategic partner in really making a difference for users and for patients.